I don't know if this is a bigger topic again, but this is along the lines of handwriting. And we're talking about like the proximal stability allows for distal mobility. What about visual perception as part, like how does that influence handwriting?
Yeah, 100%. A lot. A lot. But it's really, but again, you can't take a good picture with a shaky tripod. So visual perception too. I know some great vision therapists who I refer the kids to, and they refer them back to me to fix the body first, right? And yes, OTs can work on visual perception, and we can assess visual perception, and we can do things. Visual perception is hard, right? Because it's hard to improve visual perception without teaching to the task. Like you really do need to break down and really get the kid analyzing and doing the tasks. It's not just doing the task, but it is asking the questions to get their brain seeing and thinking about the different things, giving them clues, giving them techniques. But it is about grading as well. So how do we build that up? So yeah, so visual perception is important. Definitely. Is there a second part to that? Like help me ask more questions, ask some follow-ups so that I can.
No, I'm just thinking in regards to one of the kids I have who the mum is like keen to work on handwriting. And I sort of haven't known where to start, but I was talking to Sophie the other week, and she suggested like assessing like visual perception to see whether that's part of the issue. And so I'm just sort of thinking in advance, like, yeah, if that does come up, and even if it doesn't for future, I suppose how do you work on that in therapy, really?
Yep. Yeah, well, and I think actually we didn't talk about assessment. So we assess handwriting by getting the kid to write some stuff. So whether we use the etch or one of the handwriting tests, we have a look at it and we want to break that down and analyze it. And we want to look at how they're forming the letters. We want to think of spatially, how close the letters are together, the gaps between words, the way they align on the, do they float off the line? Are they sizing? So some of those things have motor components to them. Some of those things are more geared towards motor. Some of those things are more geared towards perception. And yeah, so we can, we always do a VMI with those kind of kids, and that helps us see the motor and visual combined, the motor on its own, or the visual on its own, and the motor on its own to a degree, right? And so we're starting to break that down. That visual perception in the VMI is actually more of a screener than a visual perception test, because there's only like 2 or 3 of each subtype of visual perception. But if that's gone, then at some stage in your future, you're probably going to reassess and check if it's still a problem once we support posture and regulation and all the other things. Because if you have poor visual attention, then you're gone on the visual perception subtest of the VMI. It might not be about visual perception. It can be about regulation. It can be about impulsivity, and it can be about visual attention. All visual perception tasks also have a visual discrimination component to them, because you've got to make sense of it. But you might then go to a TVPS to try and break that down further and get a bit more information about what's happening there.
Yeah, so I was on doing the TVPS with him. So is maybe starting with the VMI first a good idea?
Or... I mean, if you haven't done a VMI, I would go to a VMI before anything else, because you can see vision motor combined and some visual spatial features about where they sit it in the box. And then you can see the vision, and then you can see the motor piece to it. So that's nice to break it down.
Yeah.
But yeah, you could do a TVPS. A TVPS will break it down into then the other sort of 7 odd
Yeah.
areas, which is really helpful.
Yeah.
So TVPS is motor free. There's no drawing. You're just using your eyes. But if you've done the fine motor in the bot, the extra stuff that the DTBP gives you is not a lot. There's a few things. Some of the spatial pieces can be useful, but it's been a long time since I've used it. But yeah, it's worth getting all that information. Absolutely.
Yeah. It's been a while since he's been in the clinic, and I feel like, yeah, maybe just
Yeah,
doing.
so I would start with assessment. I would certainly start with a VMI, all 3 sections,
Yeah.
100%. If handwriting is the goal, then I would want to get at least one sentence out of him to see how he does quick bound fox jumps over the lazy dog.
Yeah. So I was planning, because I was talking to Sophie about it, and she said the etch might be helpful.
The etch is good, and if you can do it, so you've got a few different sentences, you've got some numbers, you've got capitals, you've got lowercase, you can get him to come with a sentence, you can do near point, you can do far point. It does cover a lot if that's what it's about. I would want to make sure I knew what was happening posturally for him. So if I was wanting, and so if you wanted, I would maybe do the body coordination section of the bot as well. So the balance and bilat.
Yeah.
Will cover a fair amount.
Yeah, that's
good to see if you can do prone extension and supine flexion too.
He holds a pencil really tight, and she said that might be a compensatory thing for like poor postural stability, because he doesn't actually appear like he's got poor postural stability, but I think he uses, because he's always seeking movement, I think he uses a lot of momentum in things.
So vestibular alerts your posture, right?
Yeah.
So is it easier to ride a bike when you're going faster or when you're going really, really slow?
When you're going faster.
Yeah, right. You can't ride a bike slow. That's why it's so hard to start. When I teach bike riding, I teach riding, then starting, then stopping. Actually, I think riding, stopping, starting is even easier, because you've got that slow with no momentum piece that you have to do a weight shift. That's really hard in bike riding, but vestibular alerts tone. So with movement, your extensors kick in. And so, if kids will wriggle to wake their body up.
Right, okay.
Kids can also do that, squeeze it tight if they don't have very good perception. So it could be a stability to get stability at the pencil for lack of stability here, and probably is, but then it could also be about discrimination and that awareness in the fingers.
Yeah.
It would be interesting to get a set of $2 coin, two $2 coins, $1 coin, 50-cent pieces, 20-cent, 10-cent, 5-cent. And I love this activity for kids, particularly when it's about, and just see what his touch perception's like. Can he, can you reach into your pocket and find the 50? That's easy enough. But can you find a $1 versus a 10-cent piece? I'd be interested to see if he can do some of that sort of stuff. Those Feely box games, or Ned's Head is a good example of that.
Yep.
And that links a lot to visual perception too, because remember, we start to learn with this eye, hand, mouth piece. So there's a lot about how we perceive things that come from our eyes learning what our mouth and hands are telling it. So yes, visual perception is important. Also in development, kids crawl at a level that gets our visual field really well attuned to this distance. So kids who don't crawl sometimes have harder time with desk focus work and that visual field that's just there. So I would make sure you know what his posture's like and what he's, and just what he can do with his fingers as well. Can he do finger touching? Can he do it back here? Not many people do this, but so you've got this one, which is, it tells you a lot about that tactile awareness, but also sequencing, right? So you can go, you can go just in one direction, or you can do a double tap and go back. But even if you're just doing it one direction, that'll be hard enough for kids. And so is he able to do it, or is he like this? Can he do it on the other hand? Can he do it with both hands at the same time? It's really hard while I'm seeing myself doing it in the computer. And then, all right, everyone do this. Hands up by your head, behind your ears so you can't see it. All right, now just touch the one I'm touching.
Oh, well, is that opposite though? Like, should we be going?
Just do mirror image. Yep. Easy one. Oh, I'm doing both. I didn't realize I'm doing both. Right, so that's one that I don't know what I was doing. I'm busy thinking it. I probably tricked you guys, but that's a good one too, to just go how much is visual monitoring versus the awareness in the fingers. Cool. That gives you plenty to work on. That was a little bit disheveled, but yes, visual perception is a big piece. And so I want to see how the product is on the page though, mostly. And so then person, environment, occupation, if it's, mostly fine, but horizontal alignment is a problem, well, maybe we bring in paper that has blue sky, green grass, brown dirt, so that he can start to visualize where those things need to form. Maybe, like he's 12, but maybe we need to bring in some element of finger spacing or some kind of habit or routine to get that sense between words. Maybe he needs to go back and like literally do the handwriting with tears program, because he's starting all his letters at 12 o'clock instead of 2 o'clock. So the C's almost look like I's. And, like what is actually coming on the page to know what we need to fix? And is he doing his B's like this? So he's finishing over here. So then he's trying to join them, or he's printing instead of cursive, so he can't keep up. Is it about legibility, or is it about speed? Is his legibility beautiful, but he's so slow that he writes a paragraph when his peers have written 3 pages? So we don't just work on handwriting. We need to work out what's the breakdown in handwriting. Why is he having trouble with handwriting? And then go from there. But by the time you're 12 also, it's very hard. And so we might want to be thinking about alternatives soon too. But, he's still got a long career that he has to write, and to even take notes in class and stuff like that. It's good to be able to get that right. So and I will tell you, you will not make changes with a 12-year-old unless the 12-year-old wants to make changes. So they need to get the purpose.
Yeah, perfect. Thank you so much.
No worries.